Okay, I think we are ready to get started. Hi, friends. Thank you for joining Tampa General and More Health tonight for a program on oral health. My name is Karen Buckenheimer, and I am the Executive Director of More Health. I'm joined tonight by my husband, Dr. Terry Buckenheimer. He's a local dentist here in Tampa and past president of the Florida Dental Association. I wanted to tell you a little bit about More Health first, and then we'll get to our topic on dental health. So More Health is a nonprofit organization. We've been here in the Tampa Bay area for 30 years, teaching health and safety education to students in grades kindergarten through high school. Over the past 30 years, we've taught over 4 million students. We have 25 different lesson topics that are integrated into the school's curriculum, such as nutrition, dental health, poison prevention, skin cancer prevention, heart, brain, many types of different lessons, really to make sure that kids have that information to really get their education into the classroom. So tonight we're going to talk about dental health. It is very, very important to make sure that we have a healthy mouth, and we're going to have a big discussion about what's been going on with the COVID-19 virus. Over the past 2 or 3 months, dental offices have been closed, and just last week, Governor DeSantis has opened up dental offices. And so one of the first questions that I have is that I missed my hygiene appointment. And so is it actually safe for us to go into the dental office and take our kids into the dental office? So Terry, what do you think?
I'll give you a good heads up.
Okay.
Thanks, Karen. It's very important that you understand that there are some changes when you go into the dental office, but yes, it is very safe to go to the dental office to obtain regular care. The reason is so that when you go into the office, for example, we are now doing temperature checks and asking a few questions to see where you've been, where you've traveled, if you've been exposed possibly to COVID-19. And when you answer those questions and you do not have a fever, then you come into the office. And we've cut down a lot of our patient base, mainly because we don't want too many people in the office at one time, just for the fact that we don't want to transmit or transfer anything to anybody. So it's been very easy. Over the years, the dental offices have been the priority of not exposing patients and to make sure that we have all the precautions set in place to not transmit any diseases. We've dealt with HIV/AIDS, we've dealt with hepatitis and other very contentious diseases. And we find that in the dental profession, that that's something we do every day. And so we've just expanded that to the coronavirus and have enjoyed having that as an opportunity to make it even more safe for you in the dental office. We sterilize everything we possibly can and disinfect everything else. So it's very, very important to feel free to come to the offices of the dentists.
Well, that's really important. And so therefore, for talking about the COVID virus and everything around our house, how do we make sure that our children are safe? What are some tips that we can do here in the home to decrease our chances of getting the COVID virus, especially related to oral health?
Well, it is safer to stay at home, and it's safer to keep outsiders away from your home so they don't bring any COVID-19 virus or anything like that into the homes. But once you're here at the homes, it's important to wash your hands, because hands inadvertently go to the nose, to the mouth, to the eyes. And unfortunately, that's direct exposure and onto mucous membranes. And it's an easy access for the virus into the body. So you want to make sure that you wash your hands thoroughly, or have your children wash their hands thoroughly. As far as oral health, it's important not to overlook oral health, even at these stages. You may be a little bit tired of putting up with the kids, or you might be a little bit tired. They may be tired of listening to you and say, hey, go in and brush your teeth. But it's important, very important, not to overlook the fact that you need to brush the children's teeth 2 times a day, at least once in the morning, either before or after breakfast, and then once at night. It's important at nighttime to be aware that that's when you go to sleep. There's less salivary flow in your mouth. And the fact that if you do eat something or drink something that has sugar, it has 7 to 8 hours of access to your teeth and can cause a cavity. So the most important thing is to brush your teeth at least twice a day and try to do it for 2 minutes. You have to make it fun for the kids. You don't need a lot of toothpaste, just a little smear is all you need. And make sure that toothpaste is fluoridated, and make sure you limit their snacks, because if they drink soda all day long, unfortunately, that leads to cavities.
Okay. So as a parent, how do I know if my child has a cavity? What are the signs and symptoms?
Well, you look, if they describe any pain or discomfort whenever they're drinking something sweet or cold or hot, then that's a likely chance that there may be something going wrong in the mouth. So make sure that you make an appointment to go see a dentist if they experience or let you know that anything like that bothers them. One thing that is important is you look in the mouth, make sure that you check the child's teeth until they're 7 or 8 years old. Oversee their cleaning. Make sure that you brush their teeth as an infant. Make sure that you have access to their mouth. Put them in their lap. That's a very easy way to get access to the teeth, so you can look directly into the mouth. If you see dark spots on the teeth, or if you see bleeding in the gums, that's an important sign that you might want to go see the dentist. Other than that, they'll let you know if something's bothering them enough. Okay. And check and see if there's any loose teeth. Make sure that you'll know when something's not right, and just make sure you call the dentist.
So Terry, for young parents that have little babies, one of the questions that we get a lot of is, when do I first take my baby to the dentist? And also, when do I start oral health? When does that begin? How old do they need to be?
Well, as soon as you get your first tooth, you're supposed to brush your tooth or your teeth.
Okay.
And if an infant doesn't like to brush in their mouth, then you use a wet washcloth and wipe the teeth off. Make sure that you get all the plaque and the germs and all the food debris off the teeth, so that there's not access to the teeth by those germs. The other thing is, make sure that the children, don't fight you too much. But when they do, if they want to do it themselves, then by all means do it, but make sure you have the opportunity to check them after, so that you can make sure that there's the removal of food and plaque and bacteria away from the teeth.
That's great. So what happens if my child absolutely hates brushing their teeth? What in the world am I going to do? Some of the parents say every single morning and night it is a major battle trying to get the kids to brush their teeth. They run into the bathroom, scrub this way, and say, "Okay, I'm done." So what are you supposed to do for that? Any helpful tips?
Well, make it a game if you can. Make it a contest. You can buy the material that stains the teeth, so that you can make sure that they know they need to brush all that red stuff off the teeth. It's a disclosing solution that will change plaque to a red color or a green color, and make sure that they have the opportunity to brush that off. It's a good game to play. It's a challenge for them, and it really helps in their ability to move that off and to make sure that the plaque is gone. The other thing is, you can sing songs. I know when you're washing your hands, supposed to sing happy birthday twice.
Right.
Well, you can, happy birthday twice, a little bit too short. So you might want to think of another song that lasts a minute, and make sure that your child either does that minute or does it twice, at least one time a day. Just get them in there and really work hard to get those teeth clean. It's important that you use fluoridated toothpaste, so the topical application of fluoride is put onto the teeth. And that will help, and find a flavor that they like. There's plenty of flavors out there.
That's true.
And if they find a flavor that they like and it's a good quality toothpaste, then by all means use one that they prefer, because the most important thing is to disrupt the plaque that's adjacent to the teeth.
All right. So what about floss? How old do you have to be to be
Well,
able to floss?
you don't
or-
have to be a given age to floss your teeth.
Okay.
But it's a difficult process, in all honesty, and I even have trouble flossing my teeth. But the most important thing is when they get to be about 6 to 8 years old, usually 7 to 8, somewhere in that neighborhood, you can allow them to try to floss. The nice thing with primary teeth, a lot of times there are, or baby teeth, a lot of times there are spaces in between the teeth, and you can get access to with floss very easily. When there are spaces, a lot of times you don't even need to floss, because you can actually brush between the teeth and remove the plaque that way. When they're tighter and they're jammed in there, then you have to be very careful so you don't hurt the child. But you should do the flossing until they're at least 7 to 8. And some children that aren't very dexterous need help a lot longer after that.
Okay, so that's great. In our dental lesson that we teach, we regarding the toothpaste, we teach the little saying, just a dot, not a lot, because on the commercials you see on TV, it's that big old amount of toothpaste that they put on the toothbrush. But for all of us, we just need a little teeny bit, a little smear, or just a dot, not a lot of toothpaste.
Right.
But it's very important to brush those teeth in the morning and then at nighttime. And so one thing that I hear you telling parents frequently is about nutrition, about sugar drinks, about water, and fruits and vegetables. Do you want to talk a little bit about
Sure.
how the role nutrition plays?
Anything that's healthy for your body is healthy for your teeth. Things that are unhealthy for your bodies, like sugary substances, drinks, food, things of that sort that have sugar, high concentrations of sugar, it's bad for you. And so you have to brush that away from your teeth so you don't get cavities. And I'll go over cavities here in just a second. I know you're going to ask me about that. One thing I want to get back to, though, also before we move further, is you had said, when do you bring the child to the dentist? It's recommended that at age 1, you take your child to the dentist. The reason is so you can prevent a lot of possible problems by an early look into the child's mouth. If they don't have teeth by age 1, don't worry. It's not that they're not ever going to have teeth. Sometimes children are later in development, and therefore it needs to be looked at by a dentist to make sure everything's in order so that you aren't looking at a problem later on down the road. So most children get their teeth at 4 to 6 months, their first teeth. However, some people are even born, some babies are born with teeth. And so those individuals should not wait past 1 to go to the dentist to make sure everything is okay.
Breastfeeding would be questions for that, right?
Yeah, that sometimes hurts sometimes.
Oh my.
But as far as toothpaste goes, again, fluoridated toothpaste, just a little smear for young people, because we don't want them swallowing a lot of toothpaste. And then a little pea size is plenty for children that are 4 to 6 years old. And then anybody older than that, still a pea size or just a little dollop or a little dot will be sufficient to brush teeth.
And then before bed, just water, right? So
After you brush your teeth, only water.
only water.
No bottles to bed with anything other than water. When the kids are off the bottle, then no milk, because that causes cavities after they brush their teeth to go to bed. So only water in a bottle or to drink after you've brushed your teeth, so that doesn't stay on the teeth overnight.
Okay, so I remember when my kids were little that we had the sippy cups. And so, a lot of people would put the apple juice and the grape juice and things like that, those sugared beverages in those sippy cups, and they carry them around all day long. So that's not good.
Not the best thing. If you want to drink something like juices or soda or anything like a Gatorade, for example, the best thing to do is to drink it and then rinse with water afterwards to dilute the acid and to remove some of the problems from the sugary substances that will stay on the teeth. If you sip a soda for an hour or 2 hours, or have a sugary drink that you constantly sip throughout the day, that exposes your teeth to much more sugar than what you would be recommended. And when you expose the teeth to sugar for a long period of time, then those bacteria have a chance to wreak havoc on the teeth. The reason they cause a problem or cause a cavity is the bacteria produces an acid when it metabolizes and uses the sugar as a food source. And once that sugar is added and the acid is formed, then that pH and the acid eats through the enamel. And even though the enamel is the hardest substance in your body, acid will still eventually eat through it. And so you want to remove that acid content plus the sugar, because that combination is deadly for teeth.
So I've heard you say a lot tonight, and mostly
I didn't think I was talking that much.
mostly the importance of oral health is very important to overall health.
Yes.
And your teeth are meant to last a lifetime. So we want to make sure that you have good oral health and that your children have excellent oral health. So a couple of tips during the COVID-19, make sure that you wash, and wash some more your hands. Make sure that you all, the whole family, brushes in the morning and at nighttime. When you store your toothbrushes, keep them in separate containers. Don't put all the toothbrushes together on the bathroom counter. And make sure that your whole family has healthy foods, low in sugar, and drinks low in sugar, no sugar, lots of water. Make sure that water is fluoridated. And for the babies, get them off to a great start. And we recommend seeing the dentist twice a year at least. And it is safe to go see your dentist and to take your children to see the dentist. So we have some resources for you that I don't want to run out of time before I tell you about that. If you will go to the More Health website, which is www.morehealthinc.org, and we have launched a brand new virtual learning center where we have 4 recorded lessons for your children, ages elementary school. Lesson on dental, teaches them how to properly brush their teeth. A lesson on poison, skin cancer prevention, and I'm blanking on the next one. But go to the virtual library and see that dental health lesson. In addition, on our website, we've created a really cute animated video for children, and it has Maggie the Magnificent Dragon, and he's super cute. And also, More Health is very much involved in the school district with the school-based sealant program. And I know we haven't really talked about sealants. If we have just a few minutes, I'll have you touch base on that. But I definitely wanted you to know about those resources and also to join us next week for the poison prevention segment that we're going to do with the Tampa General's Poison Center. So that's going to be really cool. And then the following week is, as I said earlier, is on mental health. But we are really thrilled to be here with you all tonight. And so Terry, I think we have maybe just a couple minutes. We want to be very thoughtful of your time. Talk to us a little bit about sealants, because I know in that school age, around 2nd grade, is when those molars are all coming in. And so it's especially important for parents of elementary school and middle school kids to know about sealants.
There's a couple things I want to squeeze in here at the end. One is always wash or rinse your brush out with hot water if you can. And you can use soap on the water, also in the water, or soapy water to rinse your toothbrush with. If your child is sick or you're sick, change the toothbrush. Don't keep it around, because you don't want those germs or viruses staying on the toothbrush for any period of time. And don't intermix toothbrushes. Don't let one person use one and then another person use one. Even though they're from the same family, you can transmit viruses and germs by using same toothbrushes, kissing, all those type things. So just be careful with that. Sealants are very important, especially in children that maybe not the best brushers in the world, and if they have deep grooves in the teeth. The grooves in the teeth are on the biting surface, and that's where food gets jammed down into those grooves. And if they're not good at brushing the food off, then cavities can start there. So a dentist likes to go in and make sure that if they need sealants, they'll go in and clean those grooves very well and then place the sealant. It's a plastic material that's liquid, and you pour it into the grooves and then you harden it with a light. Doesn't hurt at all. And what it does is protects those grooves from getting filled with food so that it prevents some cavities. And it lasts usually anywhere from 2 to 5 years. And it's a great way to reduce the opportunities for cavities to start. So it's a great way to, and pretty inexpensive also. So it's a nice way to prevent cavities, especially when they're not quite paying that much attention to brushing.
Okay, that sounds great. And for Hillsborough County School District, we work with teaching the dental education, and then there are services that come to the school and provide those sealants at no cost to the families that are in the Title I schools. So that's a really cool program. So I hope you all have had a little bit of education on oral health, and we know this has been a really tough time, and we encourage you all to continue staying safe at home and making sure your kids that are probably snacking all day long and eating some of those sugar foods and carbohydrate foods, that just make sure that you have them rinse really well with some water throughout the day and do their brushing in the morning and at nighttime, and definitely it's safe to go to the dental office. Right. Thank you all very, very much, and we look forward to seeing you next week for the poison program next Thursday. Thank you very, very much. Good night.
Bye, everybody.